So you had an X-ray or an MRI and now you have spinal stenosis. What does this mean and what do you do next? Make sure you listen to the end because there's a big but at the end of this. So what is spinal stenosis? Stenosis basically means closing down of an area of a hole, and you basically have two holes in your spine. You have the central hole and then you have the lateral hole. In this central hole is where your spinal cord is. Now, pressure on this area causes upper motor neuron symptoms, which would mean like hyperreflexia, increased reflexes, clonus, gait ataxia, maybe drop attacks. These are more serious conditions, and this is a little bit less common, although it still happens. Lateral stenosis is a closing down of this area called the foramen, which is where your spinal nerve emerges from the spinal cord and comes out and travels down your body to innervate the muscles, skin, tendons, fascia, whatever. This area closes down and it causes lower motor neuron symptoms, which would be decreased reflexes, which would be weakness, fatigability, pain, numbness, tingling to this area. This is much more common. The causes of both of these problems are actually the same. Any type of disc issue, a herniated disc, a prolapsed disc, a disc bulge can put pressure on the nerve and cause these symptoms. Degenerative disc, where the disc actually kind of squeezes down over time, naturally causes this hole on the side to close. Something called a listhesis, an anterior listhesis, which is slipping forward of one vertebrae on the other, or a posterior listhesis, slipping back, retrolisthesis. This actually causes pressure centrally or laterally as well. These facets can actually become arthritic, almost like a bone spur, and that'll put pressure on the nerves. Ligaments can hypertrophy and put pressure on the nerves. Basically, anything that closes down these holes, which is most things, can cause pressure on the nerve and cause this issue, spinal stenosis. So what do you do for it? Well, here's the giant but. By the time you hit 40 years old, if you had your spine imaged, either with an X-ray or an MRI, you are somewhere around 80% likely to have one or many of these findings without any symptoms whatsoever. So, just like you show signs of aging on the outside, you show the same signs on the inside. But when you go to the doctor and they give you these findings, they scare the shit out of you, and they don't tell you that these symptoms, these findings, might have just been there in the first place. You need to correlate it to your clinical symptoms, to how you move, to where your symptoms are, because often what they found on the image wasn't your actual problem, and now you're getting the wrong treatment to the wrong area. And a lot of these symptoms are actually treatable, because remember, any of these findings could be there without symptoms. So a lot of your symptoms are treatable, and you don't actually have to go chasing the findings of the image.